Good morning, Senior Healthcare Solutions clients. My name is Ken Brannigan, lucky brother to our owner, Melissa McCalla, and today I have the honor of educating you and showing you how you can quote, compare, and enroll yourself in a Medicare prescription drug plan. Through the years, we've been asked by our clients, and even more recently with our newer clients, if you all had the ability to do this on your own. And the answer is yes. And so as we approach the most common enrollment period, the annual enrollment period, which runs from October 15th through December 7th, we felt what better time than to roll this out to you all, educate you on how to do this. And so come the enrollment period, for those of you that are interested in doing it on your own, you'll have the ability to do so. With that said, we're going to send you an enrollment link through your email, and it's going to come from the agent that originally assisted you with your policy. So even if you decide to change plans and enroll on your own through this platform, the agent that originally assisted you will still be attached to your policy. So no worries there whatsoever. All right, let's go ahead and get started. When you click the link in your email, it's going to take you to a page that looks just like this. Up in the top left-hand corner, you're going to notice a logo that's a little different from ours, and that's because it is. Your Medicare is a non-government resource that provides us the tools and resources that we need to quote different Medicare plans. Up in the top right corner of every page, for the most part, you will see our phone number. So if you get stuck anywhere, you have questions, or you just want to be sure that you're choosing the right plan before you enroll, you can pick up the phone and give our agents a call. With that said, the first thing we're going to want to do is enter in our zip code. So I'm going to go ahead and enter 32780 for comparison purposes today. And then I'm going to click on See Plans and Prices. So this tool allows us to quote more than just Medicare drug plans. It does include Medicare Advantage plans as well. But for the purpose of this video, we are only going to be showing and educating you on how to quote your Medicare drug plan. And so I say that because when you click your zip code, it's going to try to take you through a step-by-step process. We can overlook that and just simply click skip. The second thing we want to do is make sure that we're clicking on Medicare Part D plans. That's our Medicare drug plans. We do not want to have Medicare Advantage plans, Part D. We do not want to have Medicare Advantage plans. We want to be sure that it's Medicare Part D plans. And you can see that when I click that, they put a nice little, dark box around the Medicare Part D plans there for you. The next thing we want to do is go ahead and add our medications. And so this tool is pretty friendly. It's going to give us 3 big boxes here, and I can start typing in the first few letters of my medication. And so in the first example here, I'm going to type in SIM for simvastatin. And you can see that it does populate other medications based on the SIM, but here's the simvastatin that I'm looking for today. And then with each medication that we enter, it's going to ask for our dosage and our frequency. And so in this case, I'll go ahead and select 5 milligrams and that I refill it every month. You also have the opportunity to put your quantity per refill. So this would be indicative of you taking 1 per day, 2 per day, or even 3 per day, depending on your medication. So for this purpose, let's just put that we take 2 a day. So I would change that from 30 to 60, and I'd put every month. And then I'd want to click Add Drug. So you can see that when I've added my drug, it puts it on a list down here. Let's add 2 more drugs just for the sake of the video. The next one I'll type in is going to be lisinopril. So I'll type in LIS. And you can see that lisinopril has 2 variations here. And it's very important that you pick the right one. It's most common that you'll find on your bottle that it'll say lisinopril-HCTZ for short. So in this case, it says lisinopril hydrochlorothiazide, and short, most commonly on your bottle, would be HCTZ. Another indicator, if you had lisinopril-HCTZ, and maybe you couldn't read the HCTZ on your bottle, the next indicator would be the dosage here. So you can see here that with lisinopril-, it's also a 10-12.5, indicating 10 milligram lisinopril, 12.5 milligram hydrochlorothiazide. And then there's a couple of variations here. And same thing if I went back and just click lisinopril, because it's just lisinopril, it's only showing me 5 milligrams or 10 milligrams. There is no 5 dash or 10 dash. So it's important that you're always selecting the right medication. In this case, we'll go ahead and do a 5 milligram every month. And this time I'll keep it at 30, indicating 1 per day. In the last step, I'll add my drug to the list. And now you can see that the lisinopril has been added with the simvastatin. The last one I want to plug in here for example purposes will be a brand name drug called Synthroid. And Synthroid is a brand name for levothyroxine, which is a common thyroid medication. So you can see again, the system pulls up many medications that start with SIN. I'm looking for Synthroid. The great thing about this tool is that it's letting me know that there is a generic available for Synthroid, which could be a huge cost savings to you as the consumer. In some cases, you may not be able to take the generic, and so you'd want to keep the Synthroid as your normal brand name, or whichever medication you're plugging in that is a brand name. However, if you do know that you take the generic, or you're interested in seeing what the generic costs in comparison, go ahead and switch that to levothyroxine. That's the generic. And I'm going to go ahead and select the 25 mcg. I'm going to leave it at 30 per month, indicating the 1 a day here, and then the last step of adding the drug. And so now I've accumulated my medication list. I'm going to go ahead to the next step. Now again, this platform is made to compare other types of Medicare Advantage plans. So for those plans, it will ask you for your doctor or maybe even about some of your health. That is irrelevant and not applicable to Part D plans. So in this case, when you see that it takes you from drugs to doctor, and it's asking your doctors, it's letting you know you're optional, go ahead and click skip. Now it's taking us to health. You can see that it's taking us on down the line. Our location, our drugs, our doctor, and now our health. Health, again, is not relevant to comparing Part D plans. So we're gonna go ahead and skip this too. Now we're in the last part here, which is the pharmacy. This is very important. I have the options of choosing a major chain, a local retail pharmacy, or even a mail order if I choose to get my prescriptions through the mail. My zip code is still here. I'm going to leave that alone, but I can expand the search. That would really only be applicable if you're in a more rural area. If you're in a more metro area, I don't really see anyone driving, more than 5 miles or 10 miles to get their medication. So for this comparison, I'm going to leave it at 5 miles. But you can see that as I change from major chain to local retail, you can see that I'm seeing Walmart and Angels and Titusville Discount, which are these smaller, local pharmacies rather than your big chains. You do have Publix in there as well. And the importance of choosing the right pharmacy is because it can make a very big difference on what you're paying for your prescriptions. So definitely make sure that also, that you may have a pharmacy that you prefer to use. We want to be sure that that is a preferred pharmacy on the plan. So now that I've plugged in everything I need, I'm going to go ahead and click View Plans. Again, I'm making sure that my Medicare Part D box is still checked. It is. And then there's a few things I'm going to check as well. One, making sure all my drugs are covered. Right? We don't want to get into a plan that doesn't cover our drugs. In this case, you can see that Aetna and WellCare and Humana, United Healthcare Mutual, they all cover the drugs. So we're good there. The next thing I want to do is look at my estimated annual cost. This is letting me know what I am paying for the year for my premium, my deductible, and the cost of my drugs. It's everything for that plan. And you can see that Aetna, in this case, the SilverScript Smart RX, is coming in at the most cost effective for the year. WellCare is not too far behind at $144 for the year. And again, that's premium, deductible, and cost of drugs. So you may be thinking, well, Ken, both of these plans have a deductible of $480. How is my out-of-pocket less than the deductible? Great question. On most plans that have a deductible, the deductible is not applicable on tier 1 or tier 2 medications. So those would be your generic medications in most cases. In those instances, you're just going to pay for the copay of the drug. It does apply towards your deductible, but because you're paying, let's just say $0 to a few dollars for those generics, and obviously only filling them once a month, you're not going to reach your deductible. So that's how your estimated annual cost for premium, deductible, and drugs is $128 and less than the actual deductible. One of the other things that we want to be sure that we're looking at, and I mentioned preferred pharmacy earlier. So underneath the drug cost details are the benefits and details tab. If I click the details tab and come down here to pharmacy status, you can see that the Publix pharmacy that we plugged in is a preferred retail pharmacy. And so now I know that if I choose this SilverScript SmartRx plan and use the Publix pharmacy, it is a preferred pharmacy and I'm getting the lowest cost possible. If you come into a plan and you see a standard retail pharmacy instead of a preferred pharmacy, that would let you know that you'd be paying a higher cost for your drugs. The plan covers your medications, but the pharmacy is not a preferred pharmacy, so your cost will be higher. And so that's what you want to look out for there as well. At this point, you may be saying, Ken, this all makes sense. That's great. Some of you may have some questions. Some of you may be saying, hey, Ken, this is a lot for me. What happens if I get to this point and I'm a little confused, or I just want to be sure that I'm choosing the right plan? Well, again, our phone number is up here in the top right, and there's a personal code generated for each of you individually as you've entered your medications. When you call us, you can give the agent that personal ID. We can plug it into our side, and we will pick up right where you left off. We'll be able to see exactly what you've done to this point. So this code is very important for you if you ever need our help as you're going through this process. Alrighty, so now that we've checked some different plans and we understand that, hey, this Aetna plan is $7.70 a month, has a deductible of $480, all of my drugs are covered, it's a preferred pharmacy, it's the least cost effective for me, right? I want to enroll in this plan. Keep in mind before we click enroll, for disclaimer purposes, that we are looking at a 2022 year. These prices that we're looking at today are not indicative of a 2023 or any other enrollment year except for 2022, and that this is for comparison purposes only. Once you're ready to enroll for 2023, you can do so starting October 15th. Again, if you have any questions about your eligibility, please don't hesitate to give us a call. Alrighty, with that said, I'm ready to pick my plan. I'm going to click the green enroll button, and from here, I'm entering simply my name, my phone number, my address, my date of birth, my Medicare information, how I want to make my premium payments, and I'm selecting my enrollment period. Again, for most of you, from October 15th through December 7th, it will be the AEP, the annual enrollment period. Otherwise, if you're turning 65 or you're new to Medicare, you're likely going to be using the IEP enrollment period, the initial election period enrollment. And for those of you moving out of a service area or losing credible coverage, you'd be choosing SEP for special election period. Those are the three most common enrollment periods when we discuss with consumers about changing your Medicare drug plan. I appreciate you watching today's video. If you have any questions, our phone number is 866-633-4427. Anyone on the Senior Healthcare Solutions team will be happy to help. Thanks so much and have a great day.